How is palpatory BP measurement done accurately? Imagine you're in a busy clinic, and you need to quickly get a good idea of a patient's blood pressure without a stethoscope. How can you do that reliably? That's where palpatory blood pressure measurement comes in. It's a simple, quick way to estimate systolic blood pressure by feeling for the pulse while inflating and deflating a cuff. This method is especially handy when noise or equipment issues make listening with a stethoscope difficult. To do it right, start by having the patient sit or lie comfortably. Support their arm so it's at heart level and relaxed. Make sure their upper arm is exposed, about 5 inches above the elbow, and free of tight clothing. This helps get an accurate reading. Next, place the cuff's rubber bladder over the brachial artery, which is just above the inside of the elbow. Wrap the cuff firmly but smoothly around the arm, avoiding wrinkles that could affect the reading. Now, locate the pulse at the wrist using your first 3 fingers. Feel for the radial artery pulse. Once you find it, quickly inflate the cuff until the pulse disappears. This means the cuff pressure has gone beyond the systolic blood pressure, temporarily stopping blood flow. To be sure, inflate the cuff an extra 20 to 30 millimeters of mercury above that point. Gradually deflate the cuff at about 2 to 3 millimeters of mercury per second. Keep feeling for the pulse at the wrist. The moment you feel the pulse return, note the pressure on the sphygmomanometer. That number is your systolic blood pressure estimate. Remember, this method only gives you the systolic reading. To find the diastolic pressure, listening with a stethoscope is needed, as palpation alone cannot determine it accurately. For the best results, use a cuff that fits the patient's arm properly. Too small or too large a cuff can give false readings. Always keep the patient's arm supported and at the same level as the heart. Avoid inflating the cuff too long, as it can cause discomfort or venous congestion. And make sure your sphygmomanometer is well maintained and calibrated regularly for accuracy. Getting an accurate blood pressure reading is vital in diagnosing hypertension. Palpatory measurement can be a quick and reliable initial step, especially when auscultation isn't possible. But remember, it's best to confirm with other methods to get both systolic and diastolic pressures. This way, you can be confident in the diagnosis and the treatment plan.